Good morning, everybody. Thank you so much for joining us again today. This is the 11 o'clock webinar that we're putting together as part of the Hispanic Response and Recovery Plan to make sure that we have this moment to be informed, to get education and enlightenment. Today, I have the privilege to have someone that is going to be talking to us about his experience. But first, just a quick reminder. The reason why we're doing these webinars and the reason why we have a response and recovery plan is because Hispanics have been disproportionately affected by COVID-19, and we have to get the response rapidly the way that COVID is affecting us, and we have to create a plan so that we can recover together. We're bringing these daily webinars so that we can be informed, educated, and enlightened. Hispanics have the highest mortality rate all across, particularly in New York City, 34% of the mortality rate. At the economic level, 50% of Hispanics have in their household either a pay cut or lost their job due to COVID. Most of our small businesses, entrepreneurs, and independent workers work in the affected industries that have been shut down, be the gig economy, the sharing economy, the service industry, agriculture. So we're disproportionately affected at the economic level as well. And lastly, we're the most exposed, disproportionately exposed, because we have 19 million Hispanics working, running the country, working on essential functions, 1 million of them in healthcare, in food supply, in delivery. So we are disproportionately affected. And on top of that, we are, and this is again, what a great way to segue to our guest today. We're the most entrepreneurial community. 86% of every job since the Great Recession has been created by a Hispanic, 50% of those jobs by a Latina. Latinas create 6 times faster than any other group in America, small businesses. And $7 billion in sales come from small businesses. So it's essential that our entrepreneurs are educated about how to respond to this crisis. And for that, it is a pleasure to introduce Jack Hidary, a tech researcher, an entrepreneur, a philanthropist with the Hidary Foundation. We're having worked with MIT, XPRIZE, now on quantum computing and AI at X, the Moonshot Factory. Jack Hidary, a friend of World Human, a friend of all. We admire you. We are very grateful for you to be able to share some of your thinking about how can entrepreneurs enter this new economy. What are the tips? What are the things that we have to be looking at as entrepreneurs in getting back to what will be a new economy? Jack Hidary, thank you for being here.
Claudia, thank you very much. Can you guys hear me and see the slides? Can you see the slides?
Yes.
Okay, great. Claudia, thank you. Michelle, thank you for arranging this today. It's great to be with you. I know we have limited time, so what I would like to do is really dive right into some thoughts and programs that we have been developing with many other leaders. We want to share it with you today. We'd love to invite you to have input and feedback into these ideas as they evolve. The core of it, let me just go into presentation mode. The core of it is really to transition to a smarter economy. You know, many of the politicians are talking about let's reopen the economy, let's reopen the economy. And of course, we do want to have a robust economy going forward as we go past some of the peaks of COVID. But the question is, what economy do we want? What structure do we want? What society do we want? And here's what we don't want. We don't want the old economy. It is clear that if you're Hispanic in America, you do not want the old economy. If you're somebody who wants to be entrepreneurial and is coming from a household without the means of privilege, you do not want the old economy. You want to move and leapfrog to a new kind of structure. And this opportunity of COVID gives us that roadmap. And so the old economy was characterized by high pollution, low quality of life, unequal access to education, unequal access to healthcare. And what I'll go through today is some of the ideas that many leaders are coming together around. And we hope to share these ideas with leaders on this call here today, but also to continue as you give input to this. Daily norms have been changed, and this is the opportunity to really rethink the status quo. And so right now, the perceived trade-off is, and you hear from the politicians is, do we favor public health and protecting everyone right now from COVID, or do we open up the economy? This is the binary choice that we're being given. We actually beg to differ. We think actually there's another way. There's a way to transition to a economy that is safe from a public health point of view and actually is a better structure, a more equal access structure. And I'll share some of those ideas today. Right now, if we go back to work the old way and everyone starts going back to their offices and their shops and their factories and their places of work, retail stores, we're going to infect far more people than have already been infected. By the end of this first wave, perhaps 60 or 70 million people will be infected in the United States. You won't hear that number, 60 or 70 million, because you'll hear just the number of reported tested positive. Generally speaking, the epidemiologist tells us that you have to multiply by 20. If you, for example, have 3 million people by June or July reported tested positive in the United States, already it's 800, 900,000. If it's say 3 million, you multiply by 20 or get 60 million. That's the total number in the population that is already infected. And so that's because most people do not get symptoms. Even those with mild symptoms are not going to go get tested. And also testing is very hard to come by. So you now think about 60 million people, 70 million people. If you open up the economy the old way, they will now have an opportunity to infect 250 million people who have not been infected yet. This is a recipe for disaster, and this is what happened in 1918, 1919 during that plague. We know that the second wave was 4 times as worse as the first wave. We do not want a repeat of that. This is a chart here. You can see the first wave of that 1918 pandemic over here, and you can see the second wave was many times worse than the first wave. We do not want a repeat of that, particularly, as Claudia said, this differentially impacts communities of color. We want to get past the air pollution. The air pollution right now is the best we've ever seen in 50 years. We don't want to give that up. We have a lot of carbon intensity in the old economy. And again, this old binary trade-off choice that we're being given. Do you want less carbon and therefore lower economy, or do you want more carbon and you can have more productivity, more things? That is a false choice. There is a third way. There is a new way that we can move forward, and we can get past this 50-year-old argument between carbon intensity and the economy. Education has been not the opportunity for all people in America. We want to make that the case, and we can do that now. Healthcare. Claudia mentioned, here are some of the numbers here. Hispanics, you can see in gray the percent of New York City population, and you can see the percent of New York City deaths. The numbers are very clear. We have to go to a better economy, a better structure, if we want to address issues like this. This is the time to do it. Very simple ideas. I'll just share 2 or 3 today because we have limited time. Idea number 1, we call it 10-minute hubs or distributed hubs. We want hubs of work that are no more than 10 minutes from your house, no more than 10-minute commutes. The average commute in America now, each way, is 1 hour. 1 hour to work, 1 hour back. This destroys and really harms the ability to have good quality of life in terms of spending time with your children, spending good quality time with your parents, relatives, and others, spending quality time with your own family, being able to go to the gym and exercise. These are all impacted by people spending 2 hours in a car, not to mention which inhaling the air pollution on the way. We don't have to have that going forward. We've seen now with telecommuting that that can work. Is the future just everyone staying home and telecommuting? No, we don't believe so. What we believe is that HQ can be there for those people who live very close to HQ of that company. Let's say it's Citibank in Midtown Manhattan, JP Morgan in Midtown Manhattan. Great. If you live within 10, 15 minutes and you want to pop over and work in the headquarters, great. But if you live in Hoboken, New Jersey, Westchester, Long Island City, Long Island, any of these surrounding areas, stay where you are. We'll create a hub for you of 100 people working for your company. It'll be managed, say, by a third party. This could be a way, for example, for WeWork to regenerate itself. I just spoke to WeWork this week, and they said, in fact, yes, they're going after this business model now to not keep opening WeWorks in downtown center cities, that's where they are today, but shut those down and actually open up in the periphery to enable Citibank to say to all its employees who do not live right next to its head office, we're going to create turnkey offices for you. We'll have the coffee, we'll have the snacks, we'll have the foosball table. It'll all be there for you in 100-person pockets, all dotted around the city. Once every month, if you have to come to headquarters, great, come to headquarters. Let's reduce commuting time by 90%. Let's retain the kind of clean air that we have now. These are snapshots of the air quality taken 3 days ago. You can see all the green. Less than 50 is very good air quality. Greater than 50, which is yellows and reds, not good air quality. If I showed you this 4 or 5 months ago, you would see yellows and reds all over New York, all over California. And of course, you'd see it in Japan. Notice Japan is on lockdown right now, so you see all greens. Notice that South Korea is not on lockdown, and you see yellows and reds. Do we want to give up this clean air that we now have for our children and our grandchildren? Do we want them to start breathing again the old air that leads to respiratory issues, worse COVID outcomes? And that's one of the reasons why you see that differential with the Hispanic community. The air quality in the Bronx, in Queens, is even worse than other parts of New York City. And these areas, because they have industrial areas, more older cars, things like that, we don't want to give that up. And so we want to retain this. And this is one of the key ways. If we reduce car commuting significantly, we can reduce this. We want to take laid off workers and empower them as freelancers and provide them with services, small businesses that will provide freelancers who are former laid off people. Already the layoffs are starting to happen all across the board. Small businesses, medium-sized businesses, all kinds of businesses. We want to empower them, and we can start new companies to empower the freelancers who are the former laid off workers. That leads to online education. In the old economy of 6 months ago, an online degree was seen as the stepchild of a real degree, quote unquote, real degree, right? If you went and took 2 years off of work and got an MBA, you're like, great, I got a real MBA. But instead, if you continued working because you needed to work to support your family, and on the job, you were both learning, but also getting a MBA online, it was not seen as great compared to the traditional MBA. In fact, I think we can convince business leaders that the opposite is true. I would rather hire somebody who is staying in the workforce, continuing to get on-the-job training in whatever job they're doing, helping to manage something at a hospital, helping to manage things at working at FedEx, at JP Morgan, at Citibank, at Google, wherever they are, and still making the effort to get an online MBA. The quality of online education has increased rapidly in the last 5 years, but the HR folks have not caught up with that trend. Let's work with CEOs, let's work with heads of HR, let's work with community organizations to convince them that the online version is actually preferred over sitting in a classroom. We'd rather have people stay in the workforce, continue to earn money for their families, and get their degree. That is actually a preferred way to go rather than the other way. And so the online education already we're seeing in the last 3 months, Coursera and Udacity, 2 of the online players, are up 300% each in signups and revenues. 300% for Coursera and Udacity. We can now take this across the board, but we must convince the universities that this is the way to go. Most universities have an online component, but it's again kind of a little mini, spin-off of the main university. And for college, if people want to go to college 4 years, that's fine. I'm now focused mainly on professional development. When you're in the workforce already, you're 30 years old, 40 years old, 50 years old, 60 years old, you want to retool, you want to upskill. We have to help, particularly the Hispanic community, upskill so that they do not bear a greater brunt of the layoffs that are about to come. 2021 will be massive, massive layoffs, and the end of 2020 will be massive layoffs. And we need to help people upskill today, right now, right here. I've been speaking to DeVry and other online universities, Coursera, Udacity, others. We can work with them. They want to work with us and provide courses, some for free, some at very low cost, to provide the community with upskilling techniques, upskilling areas that they can then prevent themselves from being laid off. If there's somebody who's a general mid-level manager in a company, they might be laid off. Let's get them analytics skills. Analytics is the #1 requested skill in the United States of America today by companies. Business analytics, data analytics, the ability to take a large set of numbers, find trends, and act upon those trends. So there are various online courses for analytics. Let's get the community these skills so that they are not the ones who are laid off. Let's now talk about telemedicine. This is one of the key areas of inequality in America, access to good healthcare. And we're not going to solve it in the old way. Having doctors' offices, having people go to the emergency room because they don't have a local doctor, a good doctor, and the emergency room becomes their primary care doctor, which is the case in many communities of color. This is not a great way to go forward with healthcare. We want to really stop the entire system of healthcare, which just happened now because of COVID, reassess, and emerge with a different kind of healthcare system. we want to actually enable the home. And so when you look at the devices on the slide here, all these devices exist today. I'm holding up one of the devices right here in my hand, a pulse oximeter. If folks do not have a pulse oximeter at their house and you have anyone who you're worried about for COVID, you want to buy a pulse oximeter for $60, $70. This is the device that you see in the picture. You pop your finger in, it tells you your oxygen level, and you can monitor somebody for oxygen levels if they get symptoms of COVID and keep them away from the hospital, not go to the hospital. One of the reasons why Elmhurst Hospital in Queens is overrun compared to other hospitals is that the communities around Elmhurst did not have good primary care physicians and access to great health care in their primary care setting. And so they rush to the hospital with any kind of symptoms because they don't know. They don't have a structure to lean on. And so Elmhurst had to provide that structure in addition to providing structure for the very, very seriously ill on ventilators and so on and so forth. Look at the connected thermometer by Kinsa. This is a very inexpensive digital thermometer that connects to your phone. Look at the otolaryngoscope. This is that device that doctors use in the office to look at your ear if you have an earache or your child has an earache, or look down your throat to see if you have a strep throat or these kinds of things. All this now could be done at the house. And you could stay at home, get this information to a doctor or to the local clinic, get the diagnosis, have the drugs brought over to you by delivery system, and then treat your loved one. And so this is a much more equitable way of doing things. I gave a presentation to a large company just a few days ago that has 1 million workers. And I said to them, in the press for the past 10 years, you've gotten massively bad press about how you offer very bad healthcare for your workers. Really, really not great healthcare for your workers. And of course, their workers are mainly communities of color. And I said, why don't you leapfrog? Why don't you buy this $150, $200 worth of equipment for each one of your workers? Give it to them to take home and leapfrog your staff, your employees, to a 50-year from now healthcare system, instead of trying to catch up to where Starbucks is or somebody else is who tries to give slightly better benefits to their workers. Just leapfrog. Don't try to catch up, leapfrog. This would mean that a single mom who has 2 kids and suddenly their kid is having a fever, she can quickly find out very immediately what exactly the temperature is and get this information to a teledoctor, get that doctor online within 30 minutes at 2 a.m., at 3 a.m., at 1 a.m., whatever the time is that the kid is sick, monitor that child and allow the doctor to tell her in the next 10, 15 minutes exactly what may be going on with that child, do a number of other tests that can be done in the home, even small blood tests. If you see the glucometer over here, if there's a family member, for example, who might have glucose issues, prediabetes, metabolic syndrome, diabetes, you could do these quick tests, transmit those to the doctor to see if maybe there's an issue there. And you can even do EKG. If someone's having potential heart issues, obviously if it's a heart attack, you need to call the ambulance, you need to go to the hospital. But somebody who has, say, some history of heart issues and want to see if there's an arrhythmia or other kinds of issues, instead of, again, making appointments, taking time, going to doctor's offices, this can be done clinical grade, and all these are FDA approved already. These are small startups that have done great jobs of making this happen, but they're in the margin of healthcare system. Let's bring them out to be the core of how we do healthcare going forward, not at the margin. Elderly care, we want to connect to the elderly in the population. Obviously now people are starting to do that. The elderly are doing things we never saw them doing before, doing Zoom calls, ordering on e-commerce sites and things like that. Let's continue to do that and empower that to happen as well. We need to make a resilient economy, an economy that values that when you look at a product, not just the price of it, but all the supply chains of how it is achieved. And that will give a lot more job security as well. So, some of the key trends that we've been seeing, of course, over the years, and you've heard about in the periphery, in China, for example, because of Wuhan, they accelerated the development of robotic delivery and these kinds of different systems. We can continue going with this and use this to leapfrog. So the action items for us are really to, I'll share this deck with Claudia, who can share it with the group. Please give us, give us your feedback, give us your input. We can suggest to people, to other companies who may be interested in these areas, and please share it with them and connect us with them. If you're at a company, be it a small company, medium-sized company, whatever it is, Can you implement a distributed office plan where not everyone has to come to the same office? I have a friend who has a company of 50 people, 50 people, and he has an office that fits about 60 people, so he has a little bit of room to grow. And he said to me, Jack, I'm going to keep my office, but I'm not going to grow my office. Even as we grow people over the next few years, we're going to have those folks work either on a rotating basis, telecommuting, or I'll create a little satellite office in San Francisco or other places where my other workers are. His main office is in New York City. And we'll go with that. But I don't want to grow some large central office anymore. I want a distributed office. I don't want people having to commute. And of course, we know that commuting is a regressive tax. We know that people and communities who have less money have to commute longer because they have to live farther away from the headquarters. So we see how you can implement that. We want to engage with HR teams to say, let's work with online education to qualify people with online education and to give support to our employees to take an online course or an online degree to advance themselves in our company. We also want to think about the healthcare issue and what I mentioned before. Can your company be one that spends the $100, $200 to get some of these devices for your employees? Maybe you can amortize it over the course of 2-3 years. Maybe even just subsidize it if you don't have the money to buy it for all your employees. Can we go to other types of associations, be it healthcare plans, be it unions, be it others, to distribute these kinds of devices? It doesn't have to be just the company buying it for the employees. There could be other associations that make it cheap and easy and affordable to do so. But just envision a community, a Hispanic community across America that has each household has these devices at home, and you can envision a healthcare system for our community that is very, very different than what we have today. And so I think there's a better way forward. A lot of people are joining us in this movement to reopen the economy to a better one, a smarter one, a more equitable one, with better access to education, more equal access to healthcare. These are the kinds of things that we can now do, but we only have about 30 to 60 days to convince leadership to do that. If you work with local community leaders, a city council person, a mayor, whoever it is, this is a deck that you please want to share with them so that we get into their minds before they hit the button and open the old economy. We do not want to open the old economy. With that, I'll pause, see if there's any questions. Claudia, go ahead, please. Thank you.
Thank you so very much. This is fascinating. We will absolutely take this deck, make sure that we maybe tailor it at one to make sure that this is speaking to Hispanic employee resource groups so that we can distribute that across the network that we have with Corporate America, all the employee resource groups, all the HR groups that have signed the Hispanic Promise, that have made a promise to protect Hispanics and to hire and promote them so that we can reinvent the rules of the game. Not only the rules, but like what you're suggesting is literally a new economy that is smarter and more equitable. And for that effort, we will take action. We will distribute this among among our network and make sure that Hispanic organizations are aware in very concrete terms. But we also want to make sure that we work with you, Jack, and we bring all the Hispanic leadership to work with you on doing something specific for the Hispanic community. How does the world after COVID looks like for Hispanics if we are going to do a hard reset, or if we're rebuilding back better? How does it look like? We would love to be able to work with you on that. The area of healthcare that you mentioned, I just want to tell you that 65% of Hispanics in America do not have a healthcare plan. So they are not covered. And that is essential for us being super exposed.
I agree with that. I think one of the action items on healthcare, Claudia, if we can work together and collaborate on, there are hospitals around the country who know that they serve mainly Hispanic community and communities of color. And they have become, as the default healthcare plan for these communities because the individuals in the community do not have a healthcare plan, so they default to the hospital. I spoke to one such hospital yesterday, and in addition to all the COVID patients they have in the hospital, this is a small hospital in a town, they have 1,000 plus community members that they are monitoring outpatient using the pulse oximeters, using these other devices, using oxygen tanks in the community to keep people and maintain them. And these are mainly individuals without healthcare plans, but are being monitored and cared for by the hospital on an outpatient basis, but proactively. And this is something that we haven't seen much, but if we work together and identify, say, 50, 100, 200 hospitals that serve the Hispanic community and form an alliance with them and say, how can we work together so that we can have this hospital as a base of operations to distribute items like this, to make it clear, and we can get foundations and charitable funds to distribute these, maybe at low cost or maybe even for free, using the hospital as a way to have people come in for a day of training, how to use these devices, how to know how to connect these devices via Bluetooth and via Wi-Fi to the hospital. And the hospital could be now a totally new conception. Instead of the hospital being just reactive care, oh my God, this person is acutely ill, rush to the hospital, ambulance. Now the hospital becomes a bastion
Warehouse.
of proactive care, wellness, exactly.
Yeah, and I love that, and I think that we definitely should look at that. A network of hospitals, a network of corporate American foundations that want to actually, like make sure that they want to distribute to their employees. There's by far more beyond the masks and equipment that we're thinking about, that we have to start thinking about for Hispanics. But Jack, in that vein, you're also very active in trying to get philanthropists to provide help for those that need it most here in the epicenter of New York City. Do you want to talk about that and invite the community to either say, I need or I can give?
Yeah, sure. And one, just to follow up on what you just said in terms of the healthcare stuff, we see these devices, these home-based devices, as very helpful in the COVID setting, of course, but the big impact is for the next 10 years, right? As we move beyond COVID, again, just to taking care of the day-to-day healthcare of a family, these devices become absolutely critical to that. What you're referring to in New York City, yes, we've been very lucky and able to go to a number of philanthropists, fellow philanthropists, raise quite a bit of money, millions of dollars. And we're out actively working with hospitals in New York City, working with hospitals. I mentioned one in Queens, working with Brooklyn Hospital. Brooklyn Hospital is a hospital in a very low income area of Brooklyn, New York. We're helping them materially with resources, with equipment. Roosevelt Hospital, Montefiore Hospital in the Bronx, another hospital that serves very low income communities, communities being hit very hard by COVID right now. And if I invite anyone on the call now who wants to work with us to serve these particular hospitals and communities, we have the resources now. What we're doing is identifying the particular needs of that particular hospital and or that particular community. So it's not just getting supplies and masks to hospitals. Yes, we're doing some of that, but it's also assessing the needs of the community. So for example, we bought 2,000 of these pulse oximeters already just in New York City to hand out, not in the hospital, but in the communities around the hospital. We have bought hundreds of oxygen concentrators, little devices that produce oxygen from the air, and so you don't need to have oxygen tanks. And this is a means of keeping, again, somebody out of the hospital, so they don't have to come to the hospital if they have some symptoms, or if they're recovering from COVID from the hospital, to get them home faster and on home-based oxygen. And so these are being managed by NGOs, local partners, NGOs, and local doctors from their practices in the actual communities. And this bigger idea of having a management system of a healthcare crisis like COVID, not just hospital-based, but community-based, is something that we're pioneering now in New York City. So we'd love to have your participation. Yep. And if you're living in a place that's not New York City and you want to take this model and copy this model in your city, we're happy to help you do that too.
And that's the way we will do it, Jack. We're planning a day of action, incentivizing corporations and individuals to give, to take action, to take one action, donate, give time, give resources for Hispanics that have been affected by COVID. The day is May 21. We started in a collaboration with one or two big organizations, and we're inviting everybody. I think that it would be fantastic to have you join forces so that we can, push and get funding for you and for those NGOs that are doing the distributions. We will distribute this deck. We will make sure that we will follow up to make, to activate those networks of hospitals, of universities and corporations so that we can reset when we can in a better way. Jack Hidary, thank you so very much for having spent this time and your wisdom with us, and for your energy towards the Hispanic community. We thank you.
Thank you, Claudia. Great to be here.
Thank you so much. Thank you. Bye-bye.